the lateral border of sternum. You can see here in front view and lateral view. Here is the lateral border of sternum, the left side. The lateral border forms a primary cartilaginous joint with the first costal rib, and presents a dim facet for synovial articulation with the upper part of the second costal cartilage. Here is a half for second costal cartilage and a whole facet for the first costal cartilage on each side, on the left side and on the right side. Half and half in the right and left side, and a facet for or notch for the first costal cartilage on each side. So what is the manubrium attachment? Let's look at these pictures. It's a very good pictures to attachment of the sternum from the anterior aspect of the sternum and posterior aspect of the sternum, or manubrium exactly. The anterior surface of the manubrium gives origin to, on each side, to the pectoralis major. It is a part of the pectoralis major muscles, and the sternal head of the sternocleidomastoid muscles that's attached here on the upper half of the anterior surface of the sternum, manubrium of the sternum. The posterior surface of the manubrium gives origin to sternohyoid in upper part, sternohyoid in lower part, Here is the sternothyroid, and here is the sternohyoid in the upper part and sternothyroid in the lower part. The lower half of this surface, posterior surface of manubrium, is related to the arc of aorta. As you can see here is the arc of aorta. The upper half is related to the left brachiocephalic vein, the brachiocephalic artery, the left common carotid artery, and the left subclavian artery. That's all branches of the arc of aorta. The lateral portions of the surface are related to the corresponding lung and pleura. The supraesternal notch gives attachment to the lower fibers of interclavicular ligaments and to the two subdivisions of the investing layer of the cervical fascia. The number 4 about attachment of the manubrium is the margins of each clavicular notch give attachment to the scapula, gives to the capsule of the corresponding sternoclavicular joint. Sternoclavicular joint. At this point, sternoclavicular joint. So the margin of each clavicular notch is clavicular notch. The margin of each clavicular notch give attachment to the capsule of the corresponding sternoclavicular joint. Another part of the sternum is body of the sternum. The body is longer, narrower, and thinner than the manubrium. It is widest close to its lower and opposite the articulation with the 5 costal cartilage. Here is it, 5 costal cartilage attachment. It has 2 surfaces, anterior, here is anterior, and posterior, and has 2 lateral borders, right and left, and 2 ends, upper ends and lower ends. The anterior surface is nearly flat and directed forwards. Look here, forward and upward. It is marked by 3 ill-defined transverse ridge, 1, 2, and 3 ridge on the anterior surface of the body of the sternum. These 3 transverse ridge indicated the lines of the fusion of the 4 small segments called sternebrae. We have 1, 2, 3, and 4 sternebrae that connected to each together and forms 3 transverse ridge. The posterior surface is slightly concave and is marked by less distinct transverse line. The lateral border, as you can see here and clearly, the lateral border of the body of the sternum form synovial joints. With the lower part of the second costal cartilage here, lower part of the second costal cartilage. The third to 6 costal cartilage, third, fourth, fifth, and sixth costal cartilage, and the upper half of the 7th costal cartilage on each side. The upper end forms a secondary cartilaginous joint with the manubrium at the sternal angle. The lower end is narrow and forms a primary cartilaginous joint with the xiphoesternum or xiphoid process. So, do you know what is it? The attachment of the sternum, body of the sternum at the anterior and posterior surface and lateral borders. So, I'm going to tell you about the attachments of the body of the sternum. Look here in the right side, from the posterior surface of the body of the sternum and the anterior surface of the body of the sternum in the left side. There are 4 attachments for the body of the sternum. Number 1 is anterior surface gives origin to either side to the pectoralis major muscles. Look on each side for pectoralis major muscles. Number 2 is the lower part of the posterior surface gives origin on each side to the sternocostalis muscles. Here is the sternocostalis muscles, the lower half and posterior part of the sternum, body of the sternum. Number 3 is on the right side of the median plan, the posterior surface is related to the anterior border of the right lungs and pleura here. On the left side,